All right, great. So today's workshop agenda is to first give an overview of community-based participatory research. Then we will talk about some examples. We have some wonderful examples provided by Kalina and by Sam today. And then we are going to have a wonderful introduction to the HARC data set by Jenna. Okay, so to begin, I'd like to do some introductions just as part of the HDR team. And so a little bit about us. So if we can just go around and introduce ourselves. So I'll go first. I'm Pamela Scheffler. I'm a postdoctoral scholar in the psychology department and a UCR alum. So I graduated with my PhD in August of 2022 and had wonderful experience at UCR. And Cecilia is actually my academic mother. So I am a recent graduate and now postdoctoral scholar. And I study motivational factors in learning and achievement. And also, as part of the HDR, I assist medical students and faculty in their statistical analyses for health disparities research. And I also am an incoming assistant professor for Landmark College. So I'm really excited to start that position. And I am very excited about introducing CBPR to the population at Landmark College. So I want to learn really more about it myself. This is a co-learning process, one of the core components of CBPR. And I want to apply that to my new position at Landmark College in the neurodivergent student population. So I'm excited to learn more about it as well and excited to be presenting today. And Cecilia, if you could introduce yourself, that would be great.
Yes, so hi everybody, welcome to the workshop. I'm Cecilia Chang. I'm an associate professor in the psychology department. I've actually been part of the HDR for about 3 years now. So my role in the HDR effort is mainly to support faculty, students, and staff member on various aspects of your research involving the community. So I've been assisting scholars and researchers in their pre-research planning, such as designing surveys, thinking about research design, things like that. And then I also assist individuals in their post data collection processes, such as how they should be managing their data, how they should be thinking about analyzing the data and actually analyzing the data and interpreting the results. So in the past few years, I feel very privileged to have worked with quite a number of different teams affiliated with the HDR. And like Pamela, I'm actually learning a lot from my role here. And really, this is a co-learning process. I'm getting very excited about the different research topics as well as the different populations that you all are working with. I'm really just feeling very lucky to be part of this. But with regard to my own research interest, I study children's motivation in school. I study how their social environment, including their parents, their school, their peers, how these different layers of their environment jointly shape children's approach to learning. So I'm really excited about this workshop. I'd love to learn more about what you do, and hopefully I'll be also part of your research journey in the future as well. So back to you, Pamela.
Okay, thank you, Cecilia. And Sam. Sam here?
Yeah, I'm here.
Oh, awesome.
Thanks, hi, everyone. I'm Sam Ying. I am the core lead for the research and infrastructure core at the Health Disparities Research Center. And I have had the pleasure of working with UCR through our HDR through being one of their pilot grant awardees. And then I kind of became a believer in all of these things. And I'm here really as a newbie, which is why I'm so excited about this workshop series, because I get to learn from it myself, even though I'm part of the center. And it would be really fabulous to get to know all of you guys who are here today more intimately through a number of other activities we have offered at our center. And my other life is as a assistant professor in the Department of Environmental Science in Soil Biogeochemistry. And I study water quality and access to safe and affordable water for everyone. Thanks, Pamela.
Thank you, Sam. And Jenna.
Hi, everybody. My name is Jenna LeCount Heinley. I am the CEO of HARC, which stands for Health Assessment and Research for Communities. We are the only non-academic agency affiliated with the Center for Health Disparities at UCR, and we are very proud of that, although we are very welcoming for other non-academic organizations to join us too. You'll be hearing a little bit more about what HARC is and what we do a little bit later. My PhD is in industrial organizational psychology. So I study how people live, work, and play, and how occupational health psychology can help organizations and individuals. I've been at HARC for 10 years, and so I study everything related to the social determinants of health, whether that's things like evaluating fall prevention programs for seniors, all the way to literacy programs for kids, or housing programs for formerly incarcerated. So I'm very fortunate to do a wide variety of research and evaluation in a community-based setting. And I'm happy to be here with you today.
Thank you, Jenna. And Kalina.
Hi everyone. My name is Kalina Michalska. I'm an assistant professor in the Department of Psychology, a colleague of Cecilia's, and I too, like Pam, I have been fortunate to receive pilot funding from the Health Disparity Center, and I have to say that it has changed the trajectory of our work. So I direct the KIND Lab, which is the Kids Interaction and Neurodevelopment Lab. And we study brain development in kids with emotional disturbances, including anxiety disorders and disruptive behavior problems. And I have to say, in the last several years, we have really shifted our priorities. We have pivoted our research designs thanks to funding at HDR, and I'm excited to tell you about it. So we study brain development and also emotion understanding, including empathy and fear and safety learning, which is relevant to both anxiety and disruptive behavior problems. So I'm excited to share some examples, but like all of you, I'm looking forward to learning from others here too.
Great, thank you, Kalina. So what is community-based participatory research? CBPR really is not a method of research, it's more of an orientation. And it's defined by Minkler and Wallerstein as a collaborative process that equitably involves all partners in the research process and recognizes the unique strengths that each brings. CBPR begins with a research topic of importance to the community with the aim of combining knowledge and action for social change to improve community health and eliminate health disparities. So the key points here are that CBPR is a collaborative effort between the community and researchers. It involves community members, often organizational representatives as well, and academic researchers equally throughout the research process. Like all research, CBPR aims to increase knowledge of a given phenomenon, most often a health disparity, but also maybe a social issue in the community. And it has been recognized as a valuable approach for learning more about and reducing racial and ethnic health disparities in particular. The knowledge gained is then translated into interventions and policy change to improve that community's health and well-being. So it's important to note that CBPR is not just doing research on human subjects in a particular community. It's not simply like an ethnography. Instead, it's a really collaborative joint effort on the part of the community and the researchers to gain knowledge and use it for the community's benefit. And there are 5 major steps to CBPR. So the first is community assessment and diagnosis. This step may involve community focus groups and maybe consultations with the community and organization leaders to understand what the main issues are and how the research team can help. Knowledge generated from this diagnosis then helps the research team and community to define the issues and the research questions. And it's important to note here that the issues really should be led by the community and not by the researchers. So, you as the academic researcher might come in with an idea that you have in mind that you want to study. Often it's, it's something in your field of expertise, but there may be a bigger issue that's more important to that community and would benefit them more. So that needs to take priority here. One example is a study that was done in South Africa. Researchers wanted to study cervical cancer, but after they consulted with the community, they learned that there were other issues that were actually more at the forefront and more of concern to them, or of equal concern, like HIV, AIDS, sexual violence. Those were of equal or greater concern to that community. So they expanded their research scope to prioritize these issues as well. And after defining the main issues and research questions, the research team can then design and implement the study. So CBPR uses a variety of methods. Historically, it's often used qualitative research, but it also uses quantitative research, and it can use focus groups, interventions, longitudinal designs, and even randomized controlled trials sometimes. And then throughout this implementation of the study, there's regular monitoring of the community and adjustments that are made based on the community feedback. After implementation, there is evaluation of the data and interpretation of the results. So this might involve categorizing qualitative data, coding for themes, and statistically analyzing quantitative data. And also here, it's important to note that the community is involved at each step of the process, including this step. And community members may be especially helpful in making sense of qualitative data and organizing themes and interpreting what quantitative findings really mean beyond the numbers, right? And then finally, there is dissemination of the findings to the community and the scientific community, which can culminate into publications. And more importantly, application of the findings to enact real change in that community. And at the heart of all of this that I like to put here is that community partnership, the partnership between the community and the researchers. So at each step of the process, there is this commitment to maintaining and sustaining this partnership. It's all about building trust, resolving conflicts, developing and sharing that knowledge base and skills, and working together to carry out the research tasks. And so those are the steps. And as you can see, like the scientific method, it's really a cyclical process. And often these CBPR studies are long-term commitment projects that continue to generate knowledge and improve the health and well-being of that community. So some of the core components of CBPR are that, as I mentioned, it's an equal partnership. So it involves equitable contribution from the community members and outside researchers. This research really differs from other types because it involves lay people in theory making, design, and interpretation. The researchers sometimes, I think, can come in with a little bit of a chip on their shoulders, thinking like they're the scholar, they know everything, but that's not what this process is about at all. And it's really this co-learning process. So community members are teaching researchers just as much, if not more, than the expertise that the researchers are bringing to the table. So it's really important to dispel any misconceptions of the researcher community member roles and knowledge to help community members so they don't feel intimidated by outside researchers' education or expertise. Another core component is that CBPR is action-based. So although researchers want to generate knowledge, there really should be a balance between that research and action. So it's very much applied research, and there should be a clear, mutually agreed upon outcome that can benefit the community. And this should really be the primary goal. And then lastly, another core component is cultural humility. So, this research approach helps outside academic researchers realize that they are just that, they are outsiders. And as such, they have limitations. It helps them gain greater understanding and sensitivity to community members' lived experiences, particularly if they're studying a group from a different cultural background from their own. So that cultural humility component is really vital to CBPR. All right, and now moving on to some benefits of CBPR. So there are 7 major benefits. And the first one is that I call asking the right question. So by involving the community as an equal partner from step 1, they can uncover these issues that are of real concern to the community members and will benefit them the most. And so, the researcher might have questions in mind, as I said, but then when they really get involved with that community, they realize they're not quite asking the right questions. They may need to refine some things. Second, CBPR also helps improve the informed consent process. So we'll talk more about this later when we talk about human subjects research in one of the later workshops. But in all human subjects research, informed consent is so important. And sometimes it's done in such a way that research participants may not really know what they're consenting to, or they don't fully understand the process, and it's just a paper and they're filling it out. And it's not really, I mean, I'm critical, but I don't think it's really thought out well. And even the researchers themselves don't really know what the exact risks and benefits are when you're dealing with a community and you're doing an intervention study. So it also helps the research team to know exactly the risks and benefits to the participants before they're even designing the informed consent paperwork by involving those community members in that process. So it builds more trust and improves that process. Third, CBPR results in better measurements. So it can improve cultural sensitivity, reliability, and validity of the measurement tools due to that community's participation. These are often, there are also often more opportunities for designing and testing the study measures before implementing them than in other traditional study approaches. So that's always a good thing to have better measurements. And then fourth, this one is obvious. There's increased knowledge because, this knowledge may be critical to understanding sensitive issues and health problems in a given population. And this is largely due to that cultural humility aspect, that insider versus outsider component of CBPR, and having that insider knowledge from community members is just really invaluable to that knowledge base. Additionally, CBPR can help improve participant recruitment and retention. So as you all know, attrition is a really big issue in human subjects research, particularly if there's a lot of waves of data collection, a big longitudinal design. And so equal involvement of the community can help build that connection and strengthen commitment to the study goals, which can result in more participant interest. So more people initially wanting to sign up to be a part of the study, and a higher response rate throughout the study and less attrition. So can really help with that. And then sixth, this approach helps increase the accuracy of data interpretation. So data interpretation goes beyond just the numbers, and that inside member may be able to see what's really going on based on the results or consider alternative explanations, outside variables that the researchers maybe hadn't thought of themselves. So it can help with data interpretation as well. And then lastly, CBPR can help increase the success rate of any intervention that is applied to the community population. So a lot of this has to do with the study being more relevant to begin with by involving the community from step one, but also considering all the other benefits, having better measurements, having more knowledge, having better recruitment and retention, better data interpretation. These all make intervention design studies really stronger overall and more likely to have a real impact on the community. So those are the 7 major benefits from CBPR. And I'm going to end with some challenges, just touching on some challenges of CBPR. So we do know that there can be some challenges, and I like to label them with these, organize them with these phrases. So the first one is, whose idea was this anyways? And I think sometimes researchers get caught up with their own assumptions of what that community needs, and they come in with their own knowledge base, being an academic, and perhaps they did their whole dissertation on this specific topic, and so they really want to study the specific thing, but the research topic should ideally come from the community. And so you may have a notion of what you want to study, but once you get involved with that community, you may have to make adjustments. So there always has to be that give and take and that balance, and ideally it really should come from that community. And then second is, I like to call it, what's in it for me? Because this one is about prioritizing community benefit over research interests. So as an academic, you have to get publications out, and you have to support graduate students and get grants. And so it's easy to get caught up in all of that and to forget about prioritizing that community's benefit. So there has to be that balance between research and between action in helping the community. And then third, this one I call That's My Job, because this is, as I said, a co-learning process. And so it's not as though like, well, this is what I'm in charge of and this is what you're in charge of, and we don't cross those lines. It's a very collaborative effort on the part of the community and the research team. And so researchers have a certain knowledge base to contribute, but community members have that knowledge base as well. And it's about sharing and engaging in that co-learning process. And also about avoiding burdening the community members. So you want to involve community members as much as possible. But as I was talking with Jenna yesterday about this, often this involves, compensating community members for their time, right? To try to avoid burdening them in involving them in these extra roles of each step of that process. So you do want to involve them, but take care not to burden them or to compensate them for their time. And then fourth is, I like to call, I take that back, because that one is about, when you're after the implementation phase and you've done the data analysis, the results may be unflattering to the community, or sensitive information may be revealed. So you always want to have a protocol in place for how to release those sensitive findings, and that should be decided upon in the beginning. And so that's just something to take into consideration as well. And then the last challenge is what I like to call, what's the holdup? And that is when you have to be careful to balance your research and action. So oftentimes, academic researchers really want to, they do the implementation phase, say they're doing an intervention, and then they want to replicate the findings to make them more solid, right? And they think, okay, that was a great first round, now let's do it again, let's build on this, let's ask more questions or go in this direction. But the community is like, wait, why are we doing more research? We can be enacting change now. We can actually be applying something to improve the community, improve the health outcomes. And so why are we pausing, and why are we just doing more data collection and more research? So you always want to balance that research and action component of CBPR so that you're really benefiting the community and you're not just prioritizing the knowledge base, right? So those are just some challenges, but as I showed you before, there's so many benefits to this type of research, and I think they really outweigh the challenges and the extra effort that's involved in doing this type of process. Okay, so now we're going to talk about some examples of CBPR, and we're going to begin with Sam talking about the Coachella Valley Water Project. So Sam, I'll let you take over here.
Thanks, Pamela. Okay, so just to introduce the lineup here is me and then Kalina. And I think the idea is that we represent a lineup of completely, like, I refer to myself as being in either pre-K or kindergarten in the process of learning CBPR. And then Kalina is like in high school. And so my project that we've been kind of like initiating for a very long time because of some of the aspects that Pamela was mentioning, that we want to have like the proper foundation and relationships with the community and community-based organizations that we're working with to like ask the right questions. And so the location, the community we're working with is in Eastern Coachella Valley. And the reason we actually found this community and the issue of arsenic and metals contaminated groundwater was through us doing a community engagement. Oh, it says community engagement student. It should say community engagement studio through the Health Disparities Research Center Community Engagement Core. I'm going to change that now. Technology lets us do this. So through doing this service that's at HDR called Community Engagement Studio, we actually were able to talk to a bunch of experts and community-based organization leaders and community leaders that are plugged into water quality issues and access to safe and affordable water throughout the state, but particularly in the Inland Empire. And from that community engagement studio, we met members from Leadership Council for Justice and Accountability, which is a law firm based in a bunch of areas throughout California. And one of the biggest cases that they handled was Oasis Mobile Home Park. So some of you might have seen this. It was in New York Times, and it was really publicized that a lot of mobile home parks specifically built for farm workers have arsenic contaminating their drinking water at levels that are 100 times higher than the EPA suggested limit. And our group are a group of geochemists. So we were invited to join this project to figure out where the arsenic is coming from and how to resolve it with different point of use treatment options. But for all of that to be done, we need to go into people's houses, collect samples, and communicate the results in a useful way, and also think about how to encourage residents to use different treatment options and a lot of the cultural reasons that people don't trust tap water. And so it goes back to what Pamela was saying. It becomes this big blend of mixed methods that are needed because all the geochemistry that we already know doesn't solve the problem of actually encouraging communities to use the water that's safe. And how do we even get funding to make sure that they have safe water? So that was my blurb. But the point being that we're still at the beginning stages of like establishing, the right communications and working with Pueblo Unido to look at the treatment options that the community has said that they're open to using, and creating the surveys with Pamela's help. So if you are interested in this project, please let me know. I'm always open to suggestions. And if you have other suggestions for me, I'm happy to hear it. Thanks.
Thank you, Sam. And Kalina, would you like to share? I actually don't have your slides in this presentation, so I thought maybe if you could just share them on your own, that would be great.
Sure thing. Just make sure I have share privileges here. Okay, one second. Okay. Can you see these? Okay.
Yes.
Yeah, great. So I don't know if I'm in high school yet, barely about to, enter middle school, but my lab is the Kind Lab here on campus. And here are the graduates, my graduate students and lab manager. And what we've been studying is the neurodevelopment of emotion understanding in kids. And specifically, we're interested in psychopathology, including disruptive behavior and anxiety disorders in kids. And so when I came to UCR almost 6 years ago now, I had a longitudinal study that was focused on disruptive behavior. And I was looking at sex differences in conduct problems, which is aggression and other disruptive behavior. Then we talked to our community members, and in speaking with them just casually, we actually, they did say that some kids struggled with disruptive behavior. But in fact, what they were concerned about is really high levels of anxiety, separation anxiety, panic, social anxiety, this is a community sample. These are not treatment-seeking kids. These are a community sample, and they had really elevated levels of anxiety, and we're not getting treatment for it as well. So not seeking treatment due to multiple social structural barriers. And so we shifted our work to focus on these kinds of questions. And I received some pilot funding from HDR, and thanks to the center, and thanks to Juliet McMullen and to David Lowe, we began to incorporate some of these CBPR methods into our research, and really pivoted to trying to understand, I think as Pamela said, trying to understand really what are the issues, trying to listen. The community that we study are Latina girls, pre-adolescent Latina girls. Girls are already at heightened risk for anxiety disorders. And now, given their sociocultural background, they're at exponential risk. And so I'm going to highlight some of the methods that we've been using. These are research assistants in my lab. What you'll note here is that we're a very diverse team. Another thing that you'll note is I am not Latina myself, and so it's not lost on me that our community members have been marginalized by individuals, white people. So I spent a long time just listening, showing up to events, showing up to communities, gaining trust, and that took really several years to do that. And so I think, to the point about it taking a long time, it really does, but it's important to take that time. And so I think Pam did a really nice job summarizing CBPR, but really for the last 4 years, we've been increasingly incorporating these CBPR approaches from sociology and public health. And it's been done by scholars in sociology, by epidemiology, gender studies, but really nothing in developmental neuroimaging. And so here we are committed to partner with the community members, to share power, to share resources and decision-making at every level. So what does that look like? And we have incorporated these processes that Pam has been talking about. And I'm going to give you an example of how we have tried to do so concretely. And again, this is definitely a work in progress. I think we're, barely scraping the surface, but it's a good place to start. So the first process for our lab to engage in is reflexivity, and we pay conscious attention to the effects of our own position. I am a white woman from Europe. I'm an immigrant to this country from Poland and Austria, but how does my position affect my relationship with research participants? And so we really try to think about our position, our set of internalized structures, and how also these are very likely to bias our objectivity. So here what we did is we generated this positionality map, and we did that together with our research participants. And it laid out each of our positions. So beginning with my my position, Shayna Lascala did this work. She was a student in sociology together with Rengin Farad. So we had our whole research team and our community advisory board, and we created this map together. And we laid out each of our positions, like social class, race, ethnicity, ability, gender, immigration status, also maternal status, because that was relevant for our work. And just to reflect on and reduce any prejudices that might derive from our social position. And so I think this is a really important stage in this sort of scientific epistemology. So then what we did is we, and this was part of the pilot funding, this was a requirement of the pilot funding that we received, and I'm really grateful for that. We formed a community advisory board, or CAB, and this was made up of mothers who participated in our study. And we had biannual CAB meetings. And these CAB members act as collaborators. They help inform our research protocols. They provide us with real life examples of issues under study. They voice the concerns of the community. They assist in developing community education resources. They help disseminate our finding. And Shayna, who self-identifies as a Latina mother, she led the CAB meetings. And we're now in this planning stages of a youth panel. So, and then we have recently had a paper accepted where we outline each of the considerations for CAB meetings. So for example, bringing CAB members to the university creates a power dynamic. So considering, having meetings outside of the university, either virtually or at a restaurant or at a park, sort of minimizes these power dynamics. So we have a bunch of considerations here. Another process is also knowledge democracy, right? A commitment to decentered research expertise. And here, we really view community members' knowledge as equally legitimate, as equally expert. And we also, we acknowledge this by acknowledging CAB members' expertise. We include them as authors in recent manuscripts. We include them as an advisory board to maintain confidentiality as well. But we do view them as experts, and we include them in our scientific publications. You'll see that here. And of course, the members give feedback. So they had the opportunity to read the paper, to give feedback at multiple stages. We also make sure to disseminate our research findings in a biannual Kind Lab newsletter. So these are some excerpt pages. We tell them what's new, some messages from me. We provide various community mental health resources. So we have a running list of community mental health resources. We have back to school raffles, holiday raffles, Thanksgiving raffle. And, this practice has also changed the kinds of questions that we're pursuing. It makes me reflect on, I come from a tradition of like a risk, antecedents of risk and risk profiles for psychopathology. But having these newsletters has made me reflect on what it is that I want to communicate back to the community, right? And it's shifted my own focus and that of my students from this sort of deficit model that I was trained in to an asset-based model. What are the strengths of the community? What are the unique coping strategies? What are the unique resilience factors of Latinx families? And so here, we disseminate our research findings as well. And finally, we really take seriously the CBPR commitment of giving back to our community, right? So it's not just like taking. I heard a talk about this some time ago where the speaker likened this process to like a mosquito just taking data, right? And here our CAB very much expressed a desire for mental health workshops. And I will add here that I tried for many years to partner with the School of Medicine, with the psychiatry department to provide these services. I hit a wall. I would show up weekly to request help from psychiatry, and finally gave up. And so we created our own mental health services. So we created a workshop series where I invited art therapy experts. So with funding, we hired an expert art therapist. We hired a dance artist. We hired a book author, and they led 3 workshops for our participants. You can see some of the photos of the workshop. So we did expression of emotions through art, expression of emotions through movement, expression of emotions through writing and picture book writing. So these are some examples. And in the upcoming phase, I'm hoping, if this should we get additional funding, I'm hoping to also now widen some of these methods to think about the stimuli that we're using in the neuroimaging scanner. So I use neuroimaging, I use standard stimuli, and I would very much like to co-engage with the community in designing better neuroimaging stimuli that better reflect the lived experiences. And I welcome any thoughts that you guys have. Thanks so much.
Awesome. Thank you, Kalina. Well, we are running short on time, but we do need to hear about the HARC data set from Jenna. So sorry about running short on time, Jenna. Would you like to share your screen and tell us about the HARC data set?
Oh, I thought you were going to share my slides, but I can't.
Oh, I can do it if you'd like.
Okay, perfect.
Yeah, I have them here. I just wanted to see if you wanted to share them. But
No, you're in control.
all right.
So as I mentioned before, HARC is a nonprofit research and evaluation organization. And this is very brief. I promise I'll keep it super short and sweet. as Pamela mentioned, we have a series of other workshops down the road, and you'll learn more about us there. But right now, my focus is on, you just heard this, hopefully you've fallen in love with the idea of CBPR and how can HARC help you? So next slide, please. So we are a nonprofit organization. HARC was formed in 2006 for the express purpose of providing population level health data for the Coachella Valley region of Riverside County. We've grown immensely since then. I've been with HARC for about 10 years, and our goal is to improve community health, well-being, and quality of life through data. So we're data geeks. As I mentioned, we've been affiliated with the Health Disparities Research at UCR since the inception of the center. And we provide two major services in what we do. There's this triennial survey that we do of the health of the Coachella Valley every 3 years that we give back to the community at no charge, or we share with researchers like you. And that's really what HARC was formed for. But then in about 2009, it was like, well, you've got these researchers around and they have this CBPR and this data experience. How can they help enrich the community? So we started doing consulting services, and we do everything from needs assessments to program evaluation, analysis of existing data. It's very much community oriented research and evaluation. It's not as you all as academics would typically think about it. So for instance, our end product isn't often a peer-reviewed paper. It's often an infographic or a video or a in one instance, a coloring book. It's much, our goal is to make our data and research accessible to the community and to stakeholders in our community. So as I mentioned, this can range from everything from, right now we're doing a study on gun violence reduction in San Diego County. We're also just launching a study on universal basic income for people who are low income in Palm Springs area. We are doing a study on how to get clinical trials involved more accessible to underserved communities by wrapping in federally qualified health centers. So really, it's a very broad breadth of what it is we do. So next slide, please. So how can we help you? We are currently part of the Research Infrastructure Core, this core, and the Community Engagement Core. And part of the reason for that is that part of HARC's role has always historically been to know who's doing what, and to be partners and connect and be part of collaboratives. So if you're listening to this and you're thinking like, oh, it'd be really cool to learn about to do research with XYZ community, but I don't know how I'd go about starting that. The answer is you email me. Especially my connections are especially strong in the Coachella Valley, but throughout the Inland Empire and somewhat beyond. So like when Kalina was talking, I was like, oh, I know a great organization that works with, teen and preteen Hispanic women working to build their self-esteem and their coping skills. I should totally hook her up with them, and they could help with that. So if there may be some communities that I don't have an in to, because I've only been working on this in inland Southern California for 10 years. So I haven't met everybody, but I have met the other people who've met everybody. So I am confident that if you said, I want to work with transgender people who are homeless, I know who you should talk to. If you said, I want to work with the farm workers, I know who I can connect you with. And I can't promise that they will want to work with you in true CBPR fashion, but I can promise that with a warm handoff, your life will be a little bit easier. And many of these are people who are very invested in the well-being of their communities and improving it. As both Pamela and Kalina mentioned, there are some barriers to overcome. Many of these communities have not been treated well in the past. For instance, I did a lot of research on COVID vaccine hesitancy in the African-American population. Well, of course, they're hesitant to have people stick vaccines in their arms when in living memory, the US government gave them syphilis, like that is natural. And so there's a lot of work to be done to overcome those and create this partnership, but HARC is here to help you do that. The other piece of what we do for the Center for Health Disparities Research is we have this great wealth of raw data, and we can share that with you. This isn't truly CBPR, but it is a great source of community level data that you may want to tinker with, and it's there for you. So next slide, please. I want to be sure I'm not going over time. We've done this survey 6 times. Our 2022 data is getting released 2 weeks from today. So I do hope you'll join us. We're just releasing the general report to the public because they aren't researchers like you. But if you want to see the raw data, we can work out a partnership and you can have that to supplement your studies and look at your analyses. The topics that we cover in our survey aren't dictated by a model or a theory. They are dictated by what the community says. Hey, I need to know this, and I don't have any data on it. And so this can be anything from, we try to be somewhat consistent from cycle to cycle, right? So you can track change over time, but we also add new topics. So for instance, for the first time on this particular cycle, we added some questions about air quality and does that limit your ability to go outside? We added some questions on experiences of racism because not that that wasn't important in prior years, but that has come to more prominence recently. We added questions about intimate partner violence for the first time this year. And we try to use questions that are also used on the California Health Interview Survey out of UCLA, so that you can compare, okay, here's how the Coachella Valley is doing, here's how Riverside County is doing, here's how the state of California is doing. Where are their health disparities? Who is being more affected by these issues? Next slide, please. So this is just some of the topics that we have on the survey in case you're like, ooh, that's very interesting. I want to play with that. We have data for adults and children. The child data is by adult proxy, but things on mental health, major disease, health behaviors like drinking or smoking or marijuana use, exercise, obesity. We have whether they have health insurance, how often they get their care, where they get their care. This time, for the first time, we have some questions on COVID, a whole wealth of data. So next slide, please. If you are interested, we do share our raw data. An example is Dr. Will Porter, who is on this call today, and his grad student, Yaning, who used our data about asthma diagnosis, and they combined that with data on emergency room hospitalizations for asthma and other respiratory issues in the Eastern Coachella Valley, looking at how air quality and respiratory health work together. So we can absolutely help share the data, explain the data, and so on. So if you are interested in that, attend our data release event. It's on Zoom. It's in 2 weeks from today. You've got the link there. And then just say, hey, this is the data I'm interested in. Can we partner on this? Or if you don't want to use our data, that's totally fine. If you just say, I want to do CBPR with this community, can you help me out? Shoot me an email, and that's what I'm here for, is to help you out with that. So that is all I have for you today. Again, there will be a more in-depth workshop on HARC and how we can help you. You can see where workshop 4. But I'm very grateful to all of you for making time for this. It warms my heart that you all are interested in CBPR. I've been doing it for about 14 years, and I'm excited to have more converts, if you will.
Wonderful. Thank you, Jenna. And thank you everyone for being here today. So this is the workshop schedule again, and just save the date for our next one, Tuesday, February 28th. I think it's actually 12 p.m. Sorry, 12 p.m. to 1 p.m. I think we'll change that, but it'll be on testimonials for how CBPR transformed me. Thank you so much, everyone. I know we ran a bit over time, but if you'd like to stay for questions, I can stick around. Thank you all for joining us today.